Good afternoon, everyone. Welcome to the Mental Health Awareness Initiative. Today we have Dr. Walid Sarhan from Amman, Jordan. He is a practicing psychiatrist and has extensively worked with issues like depression, anxiety, bipolar, suicidal tendencies, etc. Welcome to the show, Doctor.
Thank you.
Like,
Thank you, and hi, everybody.
if you could just share as to what you have been doing and what issues are you facing more right now due to this pandemic?
Well, I have been practicing. I am a senior consultant psychiatrist. I am a fellow and member of the Royal College of Psychiatrists in UK and international distinguished fellow of the American Association of Psychiatrists. And also, I am an honorary member of the World Psychiatric Association, and I am the chief editor of the Arab Journal of Psychiatry. I have been practicing since 1985 and in Jordan and the region all over the Middle East. During the pandemic, we have so many difficulties we have faced in seeing patients being able to come using online consultation. Sometimes people are unable to travel distances because of lockdown and so on. But these are issues related to everybody. The issues related to psychiatry has been more cases of anxiety, obsession, phobia, coronaphobia among in the general population, and more cases of depression and anxiety in patients who are in lockdown or who are staying at home with somebody who developed the infection. Also, we have seen many problems with patients who get the infection and develop some sort of psychiatric manifestation during hospitalization and afterwards. All these issues have made really a burden on the psychiatric services, but the expectation from myself and from the WHO and everybody that we will be facing another epidemic of mental health over the next year or more because of an increased level of mental health, increased level of suicide, and substance drug abuse as well.
As you have rightly said, yes, you have pointed out a very good point in the sense because phobia and the fear factor due to the corona is seen very prevalent, in teenagers and even adults. So if you link it to the mental health aspect and relating to the suicidal thoughts, what would you comment on this aspect?
Well, it's, in coronaphobia, people they start avoiding everything, avoiding going out, avoiding contact with everybody, confined to their rooms, even not moving around within the house. And this has a great impact on their mental health, and they develop depression, and some of them suicidal tendency. Others, they have this phobia, but they are managing and going on in and out, but they are using excessive precautions beyond what is recommended, washing their hands many times, disinfecting everything, carrying alcohol with them wherever they go. They have to clean and re-clean and so on. And this is of course is making some patients who were already suffering from psychiatric problem worse, or patients who have recovered from psychiatric conditions relapse again, as well as new people who have never had any psychiatric issues becoming sick. Regarding the suicidal thoughts and tendency, it's seen quite commonly now, and especially in those who develop depression and severe phobia. And people are actually trying to kill themselves, and to some extent, some succeed. We all know that suicide is one of the main killers in the world. The WHO estimation of the 900,000 suicide per year, which is, to me and all professionals, is underestimation, because in many countries the number of cases that are recorded is much less than the actual number. So
Okay.
the suicide rate, which is about 20 suicide case per 100,000 population per year as an international average. This is in some countries, like in the Middle East, you will find it's like 1 or 2, 3%, 3 cases per 100,000 population per year, which is far less than expected. And because of the stigma, there are a lot of cases that are considered accidental or otherwise, to avoid the stigma. So we do have a challenge now and in the coming few months, and maybe more than that, in facing this epidemic of mental health and suicide, as well as the epidemic of substance misuse. We do have here in the Middle East some countries that have never been known to have drug problem. Now they have epidemic of methamphetamine abuse, like in Iraq, for example, which was never one of the countries that is suffering badly from this problem. So we do see that there is a need for more awareness among the public, among the decision makers, the health ministers, the health authorities everywhere, and also the media. Unfortunately, the media is focusing on number of cases, number of tests, number of deaths, and they never care about all the millions who are watching, and the children who are scared of these figures and numbers, and the repeated news broadcast that keeps on saying things about death and serious patients, and the number of patients in intensive care, and also all those things. Very little is encouraging, or in the mainstream media, as well as in the social media, apart from exceptional professionals who do act and try to help and give some advice. Unfortunately, children are, in most countries, are learning online. They have no interaction with other children. They have little chances to play with outside their house and outdoors. And even indoors, they may not have anybody to play with. And also the family is overwhelmed with the crisis and cannot tolerate their noisy behavior, and that the house becomes a sort of very turmoil state. This is all need to be addressed and highlighted in all media and everywhere, because people are suffering, and we in the clinic day and night. We see this. We answer patients from all over the world about their suffering. And, and as you know, in some countries, some psychiatric hospitals were closed and changed to corona patients. And all of this is a very challenging for professionals and leaders of mental health worldwide and regionally.
Very rightly said that this is a challenging time, both for the health providers as well as millions of people who are silently, as you have said, watching the social media or the news channels, looking at the figures or listening to the figures and getting affected by it. So, this is very true. And if you have to tell to our listeners as to what they can do if they identify themselves, or what the other family members can do if they identify someone in the house, slipping towards depression or let's say having the thoughts part also because of the hopelessness or the fear factor, what would you suggest?
Well, I suggest first to look into primary prevention. That means trying to prevent people from becoming sick in the first place. And this is in this situation can be done when people keep their social contact going on, even not necessarily face to face. They keep their routine, daily routine regular sleep hours, regular meals. Uh, there is no point of spending the day and night in bed, overeating and doing nothing. They have to reorganize their daily schedule, and especially when there is lockdown and there is limited time outdoors and indoors, to spend the time doing something, some hobbies, reading, watching movies, playing simple games, not spending the whole day either on the news or the screens with games and electronic life. This is the first step. Next step, when people start feeling low or anxious and desperate, angry, irritable, uh, everybody around them will notice that, and uh, they shouldn't actually dismiss this as that's just being troublesome. When somebody is becoming depressed, irritable, anxious, fearful, his mood is bad, he needs support, not to be told, stop that, don't do this, don't do that. This is what you are doing for yourself. And that's usually makes things worse. And in many cases, the person start thinking of suicide, planning suicide, and may attempt suicide. But usually, and in 70% of the cases, that patients kill themselves, they have already communicated this openly to the family or to the doctors, but nobody have done anything about it. So when somebody mentions suicide or I'm better off dead or any word of that sort, the family and the friends and the group around them should take it seriously, stand next behind with him, support him, be with him all the time, try to see what's going on. If this is not going to work, although it may work in many mild cases, then you will advise him to seek professional help. And after seeking professional help, patients who are depressed usually are so desperate and hopelessness and helplessness will lead them not to adhere to treatment, not to go for follow-up, and so on. So people around them should do their best to make sure that they are going to the doctor in their appointment, taking the medication, attending the therapy session, whether in person or online, and to keep checking on their suicidal ideas and thoughts. Because what happens usually when somebody actually kills himself, everybody around him is becoming depressed because he has clearly made it to everybody that he is going to kill himself, but they didn't do anything to stop it. That's very unfortunate. Instead of helping that person, now we have to help 5 persons who did not support him. So I believe that the layman, the public, the family, the friends can do quite a lot of good support. At the same time, if they wish, they can be a very bad influence. They can be sarcastic, critical, humiliating this person, and push him the last little push to the end and death.
It is firstly, that you have mentioned the first thing, that stay away from the news and all, do the routine work regularly, and then moving ahead, the support system should be very proactive and one should take care of each other and listen to what any member who is in the family voicing out. If they are feeling too low for a long time, they should not condemn that person, rather address it in a very positive way and should be there for everyone. So that is a very good thing, doctor, that you have shared. Yes, we all as individual, as family, as support system in the society, we should be there for each other. You have absolutely mentioned a very valid point, which everyone should make note of. What we are saying, just not hearing, but listening empathetically to each other. So, if at all, to the youngsters, to the youth, how should they hold on in this tough moment? What would you
Well,
suggest?
for children and adolescents, the matter is actually more at the hands of the parents, because parents often think of children and adolescents as if they are immune of any mental illness or psychological trouble. And this is not true. The major psychiatric problems start in adolescence, things like schizophrenia and bipolar affective disorder. So the changes that could happen in children, whether in pandemic or otherwise, should be taken seriously and may not necessarily to go to a psychiatrist immediately. There are many people who can help, counselors in the school, counselors everywhere. Somebody who with experience could say that this is normal, this is beyond the ability of a counselor, this needs professional help, but dismissing everything in children as he is going to grow out of it. This is usually fatal mistake that people keeps doing, and the patient or the child, for example, is not doing well at school, and they attributed this because he's playing too much. And then he's now not going to the school, and they find an excuse. Well, these are not solutions to find an excuse. These are promoting this abnormal behavior, and the parents and carers should be very sensitive for any change of behavior in children and adolescents. For example, for an adolescent to become depressed, depression in adolescents is not going to appear exactly like adults. They are not just sitting sad and they don't like to do anything and they don't enjoy anything. They are more or less irritable and going on down in their academic performance, and sometimes even is not going to the school. And this may not appear to be depression. It looks like as if he's just becoming lazy, or he's
Active.
into a love story or something like that. But actually, this is how depression presents in such a group. So the sensitivity to child and adolescent, a change in emotional or behavioral pattern should be very well observed and looked after. And if when somebody reach a professional, at least he can know whether this is something serious and needs help, or it is he can manage himself. Many things, that like children in between 3 and 5, every day they are scared of something. But we know that these are not phobias, they are transient fears that just go away if we manage this properly. If we don't push the child to avoid the situation, and just on the other hand, push the child to face the situation and reinforce this. And this is, for example, something transient, doesn't need the help, just need awareness of the family. Things like a childhood rebellions, and sometimes adolescent rebellion, and the adolescents who starts, he doesn't want to study, he wants to go with friends, he spends the time on the phone, she wants to talk to the boys, the society may not allow that, and things like this also could be transient, and if handled properly and gently, sensitively, it can be over within weeks. But with harsh approach, it can go on as sort of stubborn behavior and become a pattern of their personality and life, and may end up with failure in school and failure in college and in life in general.
Okay, so it's like You have also drawn the attention wherein the parents need to be really sensitive and not label. Actually, it's called labeling also in a very common term when they are repeatedly saying, oh, you are like that, and you are like, as you have said, it's only a transient stage wherein this will ebb off with time, but repeated reminders in with the harshness may instill that behavior. So, very true. And now that lockdown is there, everyone is at home. So the went out is also not there for the youngsters or adolescents or children, and even for parents. So, for right now, if two, three tips you would like to say before we wind off as to yes, we need to be empathetic, we need to be sensitive, good listeners. Besides this, if you could just share your with from your experience, two more points.
Well, it's the point I would always continue to raise, that parents get married and plan everything, plan their wedding, plan their home and all the details and the honeymoon, and but they never prepare themselves to how to bring up children. When you buy a mobile or a new TV, you look into the catalog and you want to know all the details. People get 4 or 5 children with no catalog and no direction of how to bring up these children, and where is the normal and where is the abnormal. I strongly advise parents to take care of this point. The second point I want to raise, also in relation to children, every day I see children who they have been from one school, moved from one school to the other, being diagnosed with all sorts of things, and being blamed or for many mistakes. And the child is simply has intellectual disability. His intelligence is far below normal, and he needs special education. But the family doesn't want to see this. And it seems that some of the professionals also would avoid this point. And this child may grow up and become 17, 18 years old with an IQ of 50 or 60, and they are still pushing him to go to the school and to get good marks, which is impossible. And this, so knowing the ability and limitation of your child is a basic mental health issue and basic in bringing up children. The other point I would like to draw the attention of the listeners to, that in many parts of the world, in our part of the world, people go to the healers. These healers of all sorts of names and kinds, native healers, medicinal herbs, religious healers, actually they are doing much harm than good. And unfortunately, in many cases, they are the first first line of defense, and the people will reach them before reaching any mental health service. And this is the big challenge in the world, and in the developing world in particular. Just going to somebody because he knows some religious words and say them, who is not going to correct the chemical imbalance that is in the brain. So please, you can be of any religion, your faith is respected, your faith could help you, but when you are sick, you need a doctor, you need a professional. You don't need somebody to give you a religious instruction how to improve your depression or suicide.
Okay, so it's a first thing, if you identify, then you should go to a proper doctor or a professional. And maybe side by side, if you want to go ahead with other healers, you may go ahead. But first thing first.
Yeah.
And had you experienced anything personal, and how did you cope?
Personally, no, uh,
Mm.
I am in good health, thanks God. I, like all physicians and psychiatrists, sometimes we are hurt when we see that the patient are able to be who could be helped are not helped because of some obstacles, like family who is not the family who's not interested in that, or objecting to our advice that this patient is suicidal and needs admission, and when they refuse this and next day he kills himself. This is the most painful moments in my life, usually.
I hope after listening to you, we have a decline in this tendency uh, in the region locally and globally, inshallah. And it's like the information that you have given today is really an eye opener for all the caregivers at home. And the listeners will surely follow it and make it as a practical routine to observe at home and also amongst their friends. If they come to know or while they are having a conversation, now they will be attentive to the words or what the thoughts people are sharing with each other. With that note, thank you, Dr. Walid Sarhan, for your valuable time and your precious advice to the listeners. People will benefit out of it, and hope we will connect with another episode in future, especially regarding bipolar in the coming months. Thank you
I
so
hope.
much for your time.
Thank you
And
for this opportunity, and I hope everybody is going to be safe, and in the next near future, this pandemic will be over and things will get better for everybody.
let's hope and we believe in it. It will end. And with that note, we end the session for today. Hope to see you tomorrow with another amazing speaker with their perspective regarding mental health awareness. Stay tuned. Good afternoon and take care. Thank you.
Thank you.